Okay, today's lecture is Skeletal System 3. We're going to be talking about the appendicular skeleton. Okay, so the first bone we're going to talk about is the collarbone or the clavicle, the bone in green. Medially, it attaches to the sternum, and laterally, it attaches to something called the acromion process, which is part of the scapula. So the clavicle here medially attaches to the sternum and laterally attaches to the scapula. And it's the only bony attachment between the upper limbs and the trunk. Because the scapula, right, this bone here, the scapula, it actually floats. It's held by muscle. It's not held to the trunk by any bones. Okay, so the clavicle is it's an S-shaped bone. It supports the scapula and arms, and it's the site of attachment for many muscles and ligaments. So right here, medially, there'll be the sternum, and the clavicle attaches to the sternum at the sternoclavicular joint. And laterally, the clavicle attaches to the acromion process which is part of the scapula. And that's why it's called here the acromioclavicular joint. Okay, so whenever you see a picture on anatomy, you should always look at the view. And even in imaging, radiology, same thing. So it's always good to look at the view. So here we have a superior view. This is the anterior end, and this is the posterior end. So by superior view, that means we are looking from above like this. So that's a superior view. So as you can see here anteriorly, the 2/3 of the clavicle anteriorly is convex, and then the distal lateral third is concave. Right here we have the acromial end, and here we have the sternal end. So here would be lateral, here would be medial. This is where the sternum attaches, and this is where the scapula attaches. Okay, so this is an inferior view. You should just know that the inferior surface over here is grooved by ligaments and muscles, while the superior surface is fairly smooth. Okay, so let's talk about the shoulder blade, or otherwise known as the scapula, which is these bones here, which are very important for movement of the arm, especially above this level, above the 90-degree angle. The scapula is very important for moving your humerus above this level. So it's important for abduction more than 90 degrees. Okay, so let's talk about some important structures of the scapula. Here we have something called the glenoid fossa. This is where the humerus, the head of the humerus, articulates. So the head of the humerus articulates right here with the scapula at the glenoid fossa. So this joint is called the shoulder joint, or anatomically the glenohumeral joint. Gleno for the glenoid fossa, and humeral for the humerus. Okay, so here we have the spine of the scapula. This is the posterior view. So you can see here, this is posterior. This is the spine. And yes, this is, by the way, this is a lateral view. So we're looking this way. Imagine you're looking at the scapula this way. Okay, so this is another lateral view of the scapula. This is the acromion process. This is where the clavicle articulates, right here. So you have the acromion right here, and this is the coracoid process. The acromion articulates with the clavicle. This is lateral right here. This is medial at the acromioclavicular joint. So this is the clavicle, and this is the acromion process of the scapula. So this is the acromion. This is the coracoid process. The coracoid process is anterior, and the acromion is posterior. Okay, so this is an anterior view. Okay, so which bone articulates here? We just mentioned it. It's actually the clavicle. So it goes here like this, and the sternum would be here. So this is medial, this is lateral. And the humerus, the head of the humerus would be here. So this is your arm. Okay, this is the coracoid process. Again, this is an anterior view. It's right here. Okay, so let's talk about the angles of the scapula. Again, this is an anterior view. Here is lateral, here is medial. So the superior angle is right here. The lateral angle is here, and the inferior angle is here. Let's talk about the border. The superior border is right here. And by the way, this is the same view and same dimensions, lateral and medial. This is the medial border. This is the lateral border. How can you tell this is the lateral border? Because you can see the glenoid fossa is right here, so the arm would be here. The arm is lateral. So that's an easy way to differentiate. Plus the direction of the coracoid process. The coracoid process is directed to the lateral side. So you can see here, this is the coracoid process. It points this way. Okay, let's talk about the fascia of the scapula from the posterior view. So this is the posterior view. This is the infraspinous fossa, and this is the supraspinous fossa. Fossa is just a depression. And then here's an anterior view. So you're looking right here, right behind the view, that's the surface that's facing the ribs. This is the subscapular fossa. This whole thing is the subscapular fossa. It's at the costal surface. So this right here, what you're looking at, we call it the costal surface or the anterior surface. Same thing. Costal surface because it faces the ribs. Costal refers to ribs. Okay, so surfaces of the scapula. Here's the posterior surface. You can tell by the spine. Spine of the scapula is posterior. And then the costal surface, it doesn't have any specific features. It's just this is how it looks like. And it's the surface that's facing the ribs. So it's also called, you either call it the anterior surface or the costal surface, like we just mentioned. Okay, let's talk about the humerus. We have the proximal end here, the distal end here, and this is the shaft. It's basically the bone of the arm. Okay, so let's talk about some of the features in the humerus. So we have here the head, we have the anatomical neck, and then we have something called the lesser tubercle, the greater tubercle, and in between we have the intertubercular groove or the bicipital groove. This is where the tendon of the biceps brachii runs along. It runs along this area. Then we have the surgical neck. We have the surgical neck right here. So this is the anatomical neck, and this is the surgical neck. This is clinically important. The surgical neck is clinically important because a lot of the times the bone can break in this area. Okay, and we also have the glenoid fossa, like we mentioned right here, which is part of the scapula, and the head of the humerus, which articulates with the glenoid fossa at the glenohumeral joint or the shoulder joint. Okay, so like I mentioned, the surgical neck is a common site of fracture in the humerus, and the biceps brachii tendon runs in the bicipital groove, so right here. Okay, so let's talk about the shaft. So this is an anterior view. Right here, this is an anterior view of the humerus. And laterally, so this is lateral, this is medial. Laterally, you have something called the deltoid tuberosity, and this is where the deltoid muscle attaches. Okay. And here we have a posterior view of the humerus. So this is a posterior view. So you're looking at the arm from behind. We have the deltoid tuberosity laterally. Here is medial. We have the deltoid tuberosity where the deltoid muscle attaches. And we also have something called the radial groove. This is where the radial nerve runs along. So it runs along the radial groove. And the radial nerve is important in innervating. Okay, we'll talk about the importance of the radial nerve during the musculoskeletal lectures. For now, it's not important. Okay, so let's talk about the distal end of the humerus. So the distal end right here. We're going to be talking about this area. Okay, so the distal end of the humerus, right here we have the lateral. Again, this is an anterior view, by the way. So we're looking right here, anterior view of the arm. This is the lateral epicondyle. This is the medial epicondyle. This is the capitulum, and this is the trochlea. Right here we have two bones. We have the radius, okay, and we have the ulna. The capitulum articulates with the head of the radius. Okay, so the capitulum articulates with the head of the radius, and the trochlea articulates with the trochlear notch of the ulna. So right here, this is the ulna, and this is the radius. Okay, the trochlear notch is basically this. This part here is the trochlear notch. It articulates with the trochlea of the humerus. Okay, so again, we have the trochlea here. This is the capitulum. It articulates with the radius, and the trochlea articulates with the trochlear notch of the ulna. So the trochlear notch is this part here inside. And then we have some features. This part of the ulna is called the coronoid process. And by the way, this is an anterior view, I forgot to mention. And here in the posterior view, this is the ulna, this is the radius. This part of the ulna is called the olecranon. Okay, so anteriorly, this part of the ulna is the coronoid process, and posteriorly, this part is the olecranon. And then here we have the head of the radius. Okay, so this is a medial view. This is a medial view of the arm. This is the radius, and this is the ulna. This is the trochlear notch right here, which articulates with the trochlea, and this is the capitulum, which articulates with the head of the radius. And this is the medial epicondyle. That's how you know this is a medial view. Yeah, and this is the radius, and this is the ulna. Okay, so let's talk about the bones of the forearm, which we just mentioned, the radius and the ulna. The radius is lateral, the ulna is medial. Ulna is medial, radius is lateral from the anatomical position. Okay, so let's talk about the proximal end of the ulna. So we are going to be focusing on this side of the ulna, okay, proximally. Okay, so we have the olecranon, which is better seen posteriorly, right here. And then anteriorly, we have the coronoid process. And then this is the trochlear notch, which articulates with the trochlea of the humerus. And we have something called the radial notch of the ulna. So this part of the ulna here is called the radial notch. Why? Because it articulates with the radial head. Okay, now we're going to talk about the distal end of the ulna. This is the head of the ulna. And then we have something called the styloid process of the ulna. Okay, so let's talk about the proximal end of the radius. So here we have the head of the radius, we have the neck of the radius, we have something called the radial tuberosity of the radius, and this is where the distal attachment of the biceps brachii tendon is located. So the biceps brachii tendon, distally, the distal attachment is right here at the radial tuberosity of the radius. And now let's talk about the distal end of the radius. We have here something called the styloid process of the radius. So this is the styloid process of the radius. This is the styloid process of the ulna. And again, the ulna is medial, the radius is lateral in reference to the anatomical position. So the radius is commonly fractured, as you can see here. This is the radius. It commonly gets fractured when someone falls on an outstretched hand. And this is called Colles fracture. It presents as a dinner fork deformity because the hand, when the radius breaks, it kind of looks like a dinner fork. So they call it a dinner fork deformity. So this usually occurs when someone falls on outstretched hands. They break the radius, and it causes something called a Colles fracture. which produces a dinner fork deformity. Okay, so the pelvis or the hip bone, it's made up of 3 individual bones: the ilium, the pubis, and the ischium. So the bone that you sit on when you're sitting on the ground is actually the ischium. And then the acetabulum is where the 3 bones meet. So this right here is the acetabulum. It's also known as the socket. This is where the femur, this is where the hip joint is located at, and we're going to talk about it now. So the femur fits in the acetabulum to form the hip joint. So right here, this is the acetabulum, and this is the femur. The head of the femur articulates right here to form the hip joint. So the head of the femur is attaches to the acetabulum to form the hip joint. Okay, so here we talked about this before in the vertebral column lecture. This is the sacrum, this is the ilium, and we have a joint between them called the sacro-iliac joint. Sacral for sacrum and iliac for the ilium. So sacro-iliac joint. Okay, now we're going to talk about the femur bone, which is also known as the thigh bone. It's the longest and strongest bone in the body. It's a very, very strong bone. Okay, so let's talk about some features. This is the anterior view. So right here, this is the anterior view of the femur. We have something called the greater trochanter, the lesser trochanter. These structures are better seen posteriorly, right here, greater trochanter and the lesser trochanter. We have the head, we have the neck of the femur, and here posteriorly, this is a posterior view of the femur. Again, we have the greater trochanter, the lesser trochanter, the neck, the head, and right here we have a ridge, which is important for muscle attachment. It's called the linea aspera. It's right here. It kind of makes like a Y. So right here, there's the linea aspera. It's seen posteriorly because it's a posterior view. It's not located anteriorly. So always pay attention to the views when you're studying these structures. Okay, so now let's talk about the distal end of the femur. Again, this is an anterior view right here. We have the lateral condyle, the medial condyle, and then the lateral epicondyle. Epi means above, because it's above the lateral condyle. We have the medial epicondyle, and then we have the patellar surface. This is where the patellar bone articulates right here, the kneecap. And then the posterior view, again, we have the medial condyle here, the lateral condyle, and then between the condyles is the intercondylar fossa. Right here, this is the intercondylar fossa. Okay. So here we have the knee joint. It's formed from the femur and the tibia and the patella. So 3 bones articulating form the knee joint. The femur, the tibia, and the patella articulating form the knee joint. Okay, let's talk about the bones of the leg. They include the tibia and the fibula. The tibia, which is we just mentioned, is part of the knee joint. The fibula, however, so here laterally, this bone is not part of the knee joint. It's connected to the tibia above and below. So it's connected to the tibia here, and it's connected to the tibia here. Okay, let's talk about the proximal end of the tibia. So we're going to be talking about this area here, We have something called the intercondylar eminence. We have the lateral condyle, the medial condyle, and the tibial tuberosity. This is where the tendon of the quadriceps muscle attaches. It's a site of muscle attachment. Let's talk about the distal end of the tibia. So this is the tibia, medially, anterior view. Here lateral is the fibula. We have the medial malleolus of the tibia, and we have the lateral malleolus of the fibula. So right here, this is the medial malleolus, and right here is the lateral malleolus. And right here, a bone articulates called the talus to form the ankle joint, which is formed by the tibia, the fibula, and the talus, and we'll talk about it soon. Okay, let's talk about bones of the hand. We have the carpals, which are the bones of the wrist. They consist of 8 bones. There's a proximal row here and a distal row here. We have, after the carpals, we have something called the metacarpals. Meta means beyond. So beyond the carpals are the metacarpals. We have the first metacarpal, the second metacarpal, the third metacarpal, the fourth, and the fifth. And then we have phalanges. In the thumb, there's only proximal and distal. And then in the other fingers, or the phalanges, we have proximal, middle, and distal. And here, by the way, is an anterior view. And we'll talk specifically now about the bones of the wrist. Okay, so in the proximal row, we have the scaphoid, we have the lunate, we have the triquetrum, and we have the pisiform. In the distal row, we have the hamate, the capitate, the trapezoid, and the trapezium. Here is lateral, by the way, here's medial, and this is an anterior view. There's a good mnemonic to know, which is so long to pinky for the proximal row. So is for scaphoid, long L for lunate, and so on. And then here comes the thumb for hamate, capitate, trapezoid, and trapezium. Okay, so now let's talk about bones of the ankle and the feet. So bones of the ankle are 7. So here's a superior view of the feet. Okay, first let's talk about bones of the ankle. They include the talus. Okay, they include the talus. By the way, this surface is where the tibia and the fibula articulate. It's part of the talus, called the trochlea. Okay, so 1 is the talus, 2 is the calcaneus, or the heel. This is also the heel bone. This is what you walk on. And then right in front of the talus is the navicular bone. And in front of the calcaneus is the cuboid, so C and C. Calcaneus and cuboid. And then we have the cuneiform bones right here. These are the cuneiform bones. We have medial, intermediate, and lateral. So the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform. And these are the 7 bones of the ankle. And then we have, these are also called the tarsals. Okay, tarsals. And then beyond the tarsals, we have the metatarsals, because meta means beyond. So we have the first metatarsal, second, third, fourth, and fifth metatarsal. And then we have the phalanges, or the feet, or the fingers of the feet. Again, for the big toe, there's only proximal and distal. And then the others, we have proximal, middle, and distal. Proximal, middle, distal. Proximal, middle, distal. Proximal, middle, distal. Okay? So like I mentioned earlier, the ankle joint is the articulation of the tibia, fibula, and the talus. Okay, so here's a medial view of the feet. We have the talus, the calcaneus, the navicular, the medial cuneiform, the intermediate cuneiform, the metatarsals, and the phalanges. Here we have a lateral view. Again, the calcaneus, the cuboid, the trochlea, which articulates with the tibia here, the navicular, which is in front of the talus. The calcaneus is in front of the cuboid, and they are lateral. So that's a good way to remember them. The lateral cuneiform and the intermediate cuneiform, and then it's not seen, but there's also the medial cuneiform, the metatarsals, and the phalanges. Okay, so here we have the tibia, and here is the fibula. So this would be the talus, and they make up the ankle joint. Okay, so tibia, fibula, and talus. Here the heel bone is the calcaneus. In front of it is the cuboid. So this would be lateral, this would be medial. In front of the talus, we have the navicular bone, and then we have the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform. And these are the metatarsals, and these are the phalanges. Then here we have some arches in the foot, because the foot doesn't actually touch the ground. It's not flat. So as you can see here, if this was the ground, the foot doesn't actually touch the ground. There's an arch here called, this is a lateral view, by the way. So this is the lateral longitudinal arch. This is the transverse longitudinal arch. And this is a medial view. This is a medial view. We have here the medial longitudinal arch. And again, this is the same arch, the transverse longitudinal arch.